In the type 1, there is a complete separation of epiphysis from metaphysis without fracture, and it is commonly seen in rickets, scurvy, and osteomyelitis. Then type 2, that is the fracture involves the physis and the triangle of metaphyseal bone, that is Thurston Holland site. This is the commonest type of the epiphyseal injury, accounting for 73% of the cases over 10 years of the age. Type 3 is that the fracture is intra-articular and extends along the physis and then along the growth plate. The injury is relatively uncommon. So, in the type 2, which involves physis and a triangle of metaphyseal bone. And so, this is the commonest type of epiphyseal injury, accounting for 73% over 10 years of age. And in type 3, there is an intra-articular fracture extend along the physis and then along the growth plate. The injury is relatively uncommon. Type 4, that is, the fracture is intra-articular and extends through the epiphysis, physis and metaphysis. Perfect reduction is necessary and open reduction is more often necessary to prevent a growth arrest. Fifth is the crushing of epiphysis, which is seen in a growth arrest and usually follows. The type 4 shows that fracture is intra-articular and extends through the epiphysis, physis and metaphysis. So for these, perfect reduction is necessary and often reduction is more often necessary to prevent a growth arrest. Then crushing of epiphysis, that is growth arrest, usually follows. Then type 6, that there is a peripheral physis lesion and described by range. Salter and Harris classification of epiphyseal injury shows that first one, this is the second, this is the third, that is more than one fracture. This is the fourth one, that is complete separation of epiphysis from metaphysis. So here we can see how there is a complete separation from metaphysis to the epiphysis without fracture. This is the second, that in that the fracture involves physis and triangle of the metaphyseal bone. So here we can see how the fracture involves the epiphysis and metaphysis. Then third, that is the fracture is intra-articular and extend along the physis and then along the growth plate. So in that case, fracture is commonly present up to the growth plate. So this is the third type of the classification. Then this is the fourth. That is, the fracture is intra-articular and extends to the epiphysis, physis and metaphysis. So in that case, it involves both epiphysis, metaphysis and physis and the growth plate. This is the fifth, that in the crushing of the epiphysis and growth arrest usually follow. So there is the crushing of epiphysis. And sixth, that is a peripheral physis lesion is described here. That is in the sixth type of the classification of epiphyseal injury. Then Salter and Harris injury shows that clinical feature, that is child complaint of pain, swelling and deformity. and loss of neighboring joint function. So the investigation shows that a routine AP, that is anteroposterior and lateral view of a plain X-ray of the affected limb, is enough to make an accurate diagnosis in children. And the treatment option shows that type 1 and 2 injuries can be managed by the close reduction, and type 3 and 4 injuries usually require open reduction. Then, the angular deformity and the shortening are the consequences of the premature growth arrest. So, the Salter and Harris injury. So, this is a diagram of a Salter and Harris injury. It shows that a child complaining of pain, swelling, and deformity and loss of the neighboring joint function. So, when we see a X-ray of AP and lateral view, the affected limb is enough to make accurate diagnosis in children. So, for these Salter and Harris injury, type 1 and type 2 injuries can be managed by closed reduction, and type 3 and 4 injury require open reduction. Angular deformity and shortening are consequences of premature growth arrest. Then the pathological fracture. When fracture occurs through a bone which has already been weakened by a generalized or localized skeletal disorder, it is called a pathological fracture. So when there is any pathology is previously present in the patient and fracture is occurred due to that, then it is called as a pathological fracture. Unlike the traumatic fractures, these fractures take place either spontaneously or due to the trivial trauma. So the quick glance at the causes of pathological fractures are: first one in the localized diseases, that is A, in infective disorder with the chronic pyogenic osteomyelitis, tubercular or syphilitic osteomyelitis. Then B, that is neoplasms in that benign and malignant. In the benign, there is the chondroma, giant cell tumor, hemangioma spine of lung, breast, prostate, kidney, then bone atrophy, for example, polio, tabes dorsalis, etc. And in the malignant, there is a osteogenic sarcoma, Ewing's sarcoma, solitary myeloma, metastatic carcinoma, and metastatic sarcoma. Then, a miscellaneous cause is that there is a simple bone cyst, monostotic fibrous dysplasia, eosinophilic granuloma. General affection of bone are shown. First one, that is congenital disorder, in that osteogenesis imperfecta, fibrous dysplasia, Gaucher's disease, etc. Second, that is generalized refraction of bone, in that senile osteoporosis, hyperparathyroidism, osteomalacia, nutritional rickets, and scurvy. In the miscellaneous, there is a multiple mycelia, diffuse metastatic carcinoma, disseminated tumor, Paget's disease, fibrosis, dysplasia, and Gaucher disease. Common site for pathological fractures are A, that is neck of the femur. So this is the femur and this is the neck of the femur, show the type of the common pathological fracture. The neck of the humerus, in that we can see this is the bone of the humerus and this is the neck of the humerus, shows the pathological fracture. Then C, that is the distal end of the radius. This shows here, that is the diagram C. This is the distal end of the radius, shows a fracture. Then compression fracture of the vertebra, that is diagram D, shows here the compression of the vertebrae. And in the diagram E, we can see the fracture of the rib here. This one and in this. So these are the common sites for the pathological fracture. That is neck of the femur, then neck of the humerus, distal end of the radius, compression of the vertebrae, and the fracture of the rib. Then when we can see a clinical feature, the patient usually complains of a fractures following a trivial trauma. He or she complain of having suffered pain and discomfort in the region of the affected bone, sometimes before the fracture. And the underlying cause of these could be either a generalized disorder.